Hi, everyone. We'll give people a minute or two more to join and then go ahead and get started. Okay, we can go ahead. So today we just sent out the agenda a few minutes ago, and this is what we'll be going over. So we're going to do a brief demonstration of the administrative portal that was sent to you all last week. Just walk you through how to use that, answer any questions that you have about it. So we make sure that you're comfortable knowing all the features and how it works. We're going to talk about Cohort 2 recruitment and what that will look like. That's going to be part of this administrative demo as well, but also get into some details around the value-based reimbursement for this new cohort. We're going to talk about the regional meetings, a little bit of the feedback that we've received from the attendees and how we plan to incorporate that going forward. We're going to talk about the collaborative web meeting and just walk through the agenda about that and let you know what to expect there. And then just some kind of quick updates and reminders and things to be aware of that we'll cover at the end. So the administrative portal launched last week. So you were asked about who we already were kind of setting up to be a user for it, if there's anyone else you wanted added. So you should have had the opportunity to edit who your users are. We're allowing for up to 3 for PO. We moved to this administrative portal because we thought it was going to be easier for you to navigate than what we previously had, a little bit more intuitive, and it allowed us to add some new features and abilities and things that we'll be able to add in the future. One of the things that we're going to add soon for everyone is a calendar right within this portal too, so you can see the deliverables and they link directly to that. So that's one new thing that we're building out, and we'll have more to come as well. So I'm now going to just switch screens and show you a little bit about the admin portal and all the different links on it. So give me 1 second to get to that. So here we've set up just a test PO so that I can walk you through and show you what this looks like and the different options along the side. So everyone can see the portal, right? Not my slides anymore. Just want to make sure before I get too far in this.
Yes.
Yes. Thank you. Thanks for confirming. Okay, so first, one thing I want to let people know, there's been some issues with the link in the email. That link is only to create the account. So make sure that you bookmark the correct page so you're able to really easily find this. And we have it in the slides that we'll send out too. So if you can't find the link to access from the email after you created your account, we'll make sure that you have it there as well. You'll have all these menu options along the side, and now we are building out this table below that's going to show you both PO level tasks and practice level tasks. So just to give like a brief overview of this, and we're going to continue adding to this and adding additional links where applicable and where it makes sense, but you can see where you are with these and also the status of them. So for this test PO, they're mostly incomplete, but you can see this one we set to ongoing. So ongoing would mean that it started. So for practice change readiness assessments, that you have them submitted for some of your practices, but not all. If none had submitted, it would be incomplete. If everyone had submitted, it would be complete. So ongoing is when you're in that status where some of your practices have done something, but not all of them have yet. So we have it highlighted in blue when it's a PO, so it's more easily noticeable. You can see exactly where yours are. So for the PO, like the tasks that we have available right now are submitting the PO quality log. So you can see this action item here where you can click to submit it if you haven't. We're trying to make it really intuitive where you can see what something is and then get right to be able to do that thing. So hopefully that's helpful. You'll also notice the due dates here do correspond to the ones that we've shared with you around these different types of things. So there's also the ability to register for the collaborative web meeting here as a PO task and to add new practices for cohort 2 if you would like to do so. And again, a bar where you can click to be taken exactly to this page where you can do it. So, and you can kind of see the same types of things at the practice level as well, which you should be familiar with, the case summaries, the trainings, etc. So then along this left hand,
I just want to say that I am in the process of updating this table for all of the POs. And so if you log into the portal and something is not entirely accurate, have no fear. I am working this morning to ensure that the statuses are up to date for all of the POs. So just an FYI. And then I see something in the chat.
Thank you so
So
much, Mick. I appreciate that. Okay, get logged in but unable to see the action URL column. Is that because you're still building it out, Mick? This column might show
no,
up.
I'm just wondering if Yvette hasn't scrolled to the right. Should be viewable.
Yeah, always look on Creator. One of the downsides is that sometimes there is this scroll to the left or right option that we're not able to kind of condense down. So if you ever get the sense that you're not fully seeing anything, there may be a scroll bar if you go down a little bit. So notice here, I can't see it, but when I get to the bottom of this section, you can. So always make sure to double check for that.
And Yvette, we can connect after this meeting if you'd like. I was not at the bottom of the section. Okay, so all set. Okay, so Yvette's all set. But I do want to note though, Jackie, scroll up to the top if you would before you go someplace else. You will all get much faster service regarding this portal and any issues you have with it. If you click on that link there or email ccteam at mct2d, that goes to our ticketing system where a group of us see the requests. So rather than emailing Jackie directly, because then Jackie has to triage it, send it to me or send it to whomever, for faster, most efficient service, please email ccteam at mct2d or click on the link right there, which should automatically open up your email client and pre-populate some stuff. And I'll do my best to get back to you within the day. So.
Thank you, Mick.
Yep.
Can you take a look at Blair's question in the chat as well, and maybe look and see what you're able to find out with Bronson's quality log that she mentions? Okay. And while you're answering that, since it's more specific, I will go on to the other sections. So previously, these tabs that you were seeing along the left-hand side here were all on like a general homepage for you, just within a table that Mick had built out and created. So now they're a little easier to navigate. You can see them all at once, and they're not just like in the top section of a screen. So the VBR metrics page should look similar to what you've always seen, except for it has its own specific tab along the side now. So nothing here is really changed, except for that the learning community piece has been built in. So this is finalized here as far as all the columns that needed to be added there. And again, with some of these things, you can go and it links you to the case, or it links you to the requirements or to the training status, just different pages within here. Next is your contacts, and I do want to note that you can edit and add your own contacts for your practices and PO. So if someone's changed, you can deactivate the contact so that they get removed from email lists, for example. So if you had a clinical champion that left, you would deactivate the old contact. We would take care of that on our back end. And then you would come here and add any new contact that you want. So we ask for first name, last name, their email, and their specific role. So that's going to be important because that's going to determine like what email lists and things like that they're added on. So we have the practices here and the role that you're assigning them. And then that shows that they're an active contact. So whenever your contacts are changing, feel free to do this within here. It'll be changed immediately. You'll be able to see them and kind of verify who's changed and who isn't. I think the one thing you might not be able to see is if they are deactivated. I don't think it will show you, but it will show us, and rest assured if you've deactivated them, they're on the deactivated list. So that is the contacts page. And again, if anyone has any questions as we go through these, feel free to either speak up or put them in the chat. Is completely fine. We created a while back a survey that was completely optional for you to use, and we don't have any for our test practices. But if you wanted to see if any providers other than the clinical champions at your practices would benefit from any of the trainings, this kind of assesses their comfort level across the different trainings and you could kind of use that to determine like this person might benefit from the medications training or the CGM training, et cetera. If you did distribute this to providers, that survey, this is where your results would show up so that you're able to see what they'd said and kind of vet those. Couple questions. Can you access the admin dashboard from the MCT2D website? So only the data dashboard. Right now, only the data dashboard is linked. Mick, it's a general link for everyone. It just gives them the sign in, right? So we could link it on our website.
Yes, we could.
Okay, we will put that on the website too, probably right under the data dashboard one, and it'll say
Yep.
admin portal, and that way you can find either.
Oh, I did want to note that as well. In terms of terminology, everyone, to better differentiate between the patient data dashboard, we are purposely calling what you're seeing here the portal. So I'm sorry, data dashboard, admin portal. Hoping that helps to differentiate between the two.
And Brandy had asked when will updates be made to the learning community section. So we've had providers complete trainings that have not showed up yet. We only get the training reports from BOMA on like a monthly cadence or so now. So when we get updates from them, we'll go in and update those sections. So that'll be one of the ones, like for the physician feedback forms, for example, like if they give feedback on a tool, those are immediately linked and immediately change as soon as they've been submitted. So those ones are much more in real time. Whereas the ones like this, where we need to get that information from an outside source like Beaumont, there might be a bit of a delay. So I should see those soon with the next report that we get back from Beaumont. So it'll just be a little bit different based on what the event is. So for our Medicaid weight loss drug coverage meeting that we're having on the 17th, like the very next day, we're going to update like the attendance to that. But it just depends. Some of the things like the ones that are external, like our CME for Beaumont, we just have less direct access to that data. So there's just a little bit longer of a lag for that. Next is your list of physicians, and this is a new thing we've added as well too. So the way that we update your physician list is through Blue Cross Blue Shield's quarterly PGIP list. So they just shared the one that they completed in April with us. And Mick, is that the basis for the data now, or are we still working on getting that uploaded and replacing the winner list?
Still working on that. Hope to have it done today.
Okay, so maybe don't look now, because it might be it'll be a little bit more accurate after this new list is added. So maybe look later on in the week. But if there is a physician, and this would primarily be if they left your practice, because this is really so we know take them off of the VBR list and to take them off of your VBR requirements list. So when Mark is not participating, we do have these notes there. You should only change them if they've left the practice or are no longer practicing any primary care at all. And then we'll take them off the VBR list and let Blue Cross know that they should have the VBR removed. So this would be used for when they're leaving practices or taking on only like different cases other than the general primary care. So you now have that ability to change those there. This just shows a list of your practices, the clinical champion. These should pretty much all be complete for the first round of recruits, where the PCRAs are. You can see what they submitted for them if you want to view theirs. This is a new page. Yep.
May I ask a question related to the participating physicians?
Yeah, of course.
Submitted a list on Friday of those physicians that had left the practice.
Yep.
Would you prefer that I go in and remove them from this list? I don't want to add more to your plate.
That would be great. Why don't I email you that after make updates to the spring list, because hopefully some of them, the changes that you had will be taken care of via that change, and then it'll maybe just be the few that aren't reflected in the PGIP list that you have to. So I'll make sure to personally let you know when it's been updated so that you can see.
So can I just build off of that question? So we have new physicians, we can add new physicians if they're not listed after you submit?
If you have new ones, let us know, because that'll be more, well, for new physicians, Blue Cross only wants to turn on like value-based reimbursement one time. So even if they join like now, let's say in May, like the practice, what we would do is like for these next 4 months, they wouldn't be held to any of those like requirements, but they would be in that year to kind of pick up then with that practice's participation. So when we will update this list again in the summer, so we are turning in all the physicians that should have VBR turned on for next year, both new and currently participating on July 15th. So I'll just make sure with you that we've captured them then, that they're on the list so that their year 2 kind of kicks in. But Blue Cross, just considering how frequently people are coming and going from practices or retiring or moving, they didn't want to have multiple start dates because it would be too challenging to have them complete like all the requirements on a short timeline.
And then one last question related to this. We have a physician that's out on a leave through July.
Mhm.
And we don't want to be necessarily dinged, if you will, because she will not be able to meet the June deadline for the first case summary submitted.
Mhm.
I noted that in the email. Is that the preferred method so that, that's taken into consideration as
Yeah, that works because those are just kind of, these one-off circumstances that we'll just kind of have to handle one-off. So yeah, that's completely fine. Just letting me know, and then we'll note that, and we won't hurt that timeline.
Thank you, Jackie.
Yep, no problem. And then there's a question, is MCTD uplift physician specific then, not practice specific? So we've recruited at a practice level, and we view like the program participation as practice level, because a lot of these changes and differences in approach, we want to make sure disseminated amongst the whole practice, and that you can have processes in place as a practice-wide approach, so that you're not trying to do things differently. But the value-based reimbursement, the way that that works, just as how Blue Cross has designed it, is it's 5% like per physician and on that specific physician's billing. So a practice enrolls, and then all of the physicians in that practice are considered participating unless they're, not seeing any kind of general PCP population. So then we would remove them. But other than that, it's at the practice level, and they're specific reimbursement uplift is physician specific. Let me know if that doesn't make sense. Okay, so this next page here, and like I said, we'll have a little bit more details on this on our next agenda topic. So this is where you would kind of recruit your second cohort practices. So as you remember how we did it last year before we had this system, we really just had Excel spreadsheets that we sent you with the eligibility, and then you sent back a different Excel spreadsheet saying who you recruited and who you haven't. So the way that we did this year to make it a little easier, less back and forth, we have all of your practices here. So, and up here are all the details. So if you don't remember the things we go over now, it should all be on here, everything you need to know. We have the eligibility criteria, which is exactly the same as what it was last year that Blue Cross asked to set for this. Either a practice is PDCM 1% and they have over 25 Blue Cross patients or BCM patients, or they're not PDCM 1%, but they have over 75 type 2 diabetes patients. Sorry, that should say that there. So down here, you can see the eligibility criteria. What Blue Cross did do is re-pull these numbers for their most recent 12 months, as opposed to the numbers that we used last year. So that's the one thing that's changed. The criteria hasn't, but the data pull has for this. So you'll see if practice is eligible or not. So this will say true or false. Both of these test practices we have here are true. And then any that are highlighted in yellow are your opportunities to recruit. Basically, they're not already participating, they're eligible. Those are the only two criteria. So when you have a practice that you've decided to have participate, or they've agreed to participate, you come right in this document and you can mark them to participating. It gives you this option just so you don't accidentally click it. It'll say yes, and then it'll show as true here. And it also generates a report for us on the back end so that we can easily differentiate the new ones that are just joining for this cohort. So when first you would look at this to look at the eligibility and determine who you may want to recruit, who you're thinking about recruiting. And then up until July 15th, you'll have the opportunity to come in here and mark them as participating. And once you do, then we'll kind of start the process with you of getting them ready to do their practice change readiness assessment and find the clinical champion and practice liaison and all of that. So for now, you're just looking at what your options are, and then you can change it here. If you have any practices that because of this new data pull, they're not eligible, so it'll say participating true but eligible false, don't worry about that. We're not gonna, Cross is of course they're gonna grandfather those in and aren't gonna say like, well, they dropped below eligibility so they aren't eligible. So they're eligible at the time of recruitment, they're good. So your ones last year are all fine regardless of what their eligibility status says now. Here you would view your QI log if you've already submitted it, and you can see your answers. If you want to submit it, that's where you'd be on this home page, and there's the link there that takes you to submitting the actual QI log. So that would be only once you've submitted it, you're able to see it here. We've also added so you can track registration. So we don't have any of these test practices registered, but this will be useful at the different types of meetings that we have. So for collaborative wide, you'd be able to click that. It would show you who's registered for collaborative. For your regional ones, like for the fall, when we have them again, you'll be able to see who has registered. They have to be PCMH designated to earn VBR, Pam. There was a question in the chat, the practice is still to be PCMH designated. But if they want to participate without earning VBR, we would still welcome them to participate. So it's not a hard stop, but I will add that so that it's clear on that page as well. Here you'd be able to see your training statuses like we've had similarly on the previous one. This is a repeat of the task log that's on your homepage. So I don't think there's any specific reason anyone would need to access one separately, right, Mick? Or is there anything they might need to know about this one that's not on the homepage?
Sorry, say that again.
So this is exactly what's on the homepage, right? There's no different features or access level on this task list, correct? It's just used as the basis.
And I could hide it on the left.
Okay.
It's the same thing, but I could hide it if that's confusing.
Okay. And then we don't have this fully completed with all of the events and things yet, but a lot actually are on here. So this would be where you can kind of see the things that are coming up. And again, it links you to specific tasks items as needed. So that is the new admin portal. For the question, will they get the practice unit recruitment reward and the per member per year? Yes, they would. So it's that 5% VBR uplift for practices that they wouldn't be able to get if not PCMH designated. Any other questions on this? And as Mick said, you can always at any point reach out to us too if you have a specific question or there's something on yours that you don't think is correct or you need to change or you want to fix, always can reach out there too.
Also, definitely want people's feedback. So for example, Jackie and I will be discussing this tomorrow, but a couple of you have asked for the ability to export this data from the portal. Features like that, feedback, I'd like this, what about this? Can this move here? Can that move there? We would love to hear your feedback about what would make this easier for you to be able to use. So any and all feedback is definitely appreciated, and we want to pivot to you. I mean, we see you as our customers, in a sense, and so we want to be responsive to your needs. So please, any and all questions, problems, or feedback, let us know.
Yep, thanks for that, Mick. Yeah, totally agree. Let us know anything you need or want to see with this, and we will do what we can to accommodate that. Okay. So back to our presentation. So to go a little bit more, the cohort 2 recruitment, this is basically everything we just stated as far as adding the practices. You can add them on the portal. It'll be till July 15th. And then you don't need to know the clinical champion and practice liaison immediately, but like ideally a month later by August 15th would be great. And so to talk about the year 2 VBR, I've started the things that are different really from what we had in the first year, but for the most part, it'll be the same. So we'll walk through this again so you can understand all of them and particularly the ones that are starred. So much like we had last year, submitting the name of the clinical champion and practice liaison by August 15th. We're going to do the trainings again. We're going to keep them all virtual for the most part, giving those 6 1-hour on-demand sessions that they'll have until the end of the year to complete. One thing that I feel like is challenging about the virtual ones versus the ones that we had in person is if any of you attended the in-person ones, there was always a lot of questions and discussion at the end. I understand that these virtual ones are really convenient as far as being able to do them on your own time, but maybe what we'll do is have like our trainers from those, the physicians who led them, offer a couple like drop-in sessions sometime in the fall too, so that people can join and ask questions if they'd like. I don't want them to miss out on the opportunity to get their questions answered, so we'll try to accommodate that in some other format. We would have the first cohort not attend the fall regional meetings, even though they'll be officially enrolled by then, but to get them kind of up to speed and doing the practice change readiness assessment and the trainings and all that, we would have them start in spring 2023. To so similar to this cohort, they joined in the fall, but they're just having their first regional meeting. So that would be what we would do for cohort 2 as well, and then kind of have them enter into that twice yearly attendance. We'll have the practice change readiness assessments again. We'll probably adapt a few of the questions and change things just based on what we learned doing it the first time. We'll keep the length around the exact same, so we won't add a lot and take nothing away. We'll just see what makes the most sense to ask, edit that a little bit as well. These ones are kind of the housekeeping kind of need to do administratively type of thing. So just responding to things in a timely manner, which we had on the first one, and presenting on the implementation of QI initiatives if requested. So if we ask them to present at a regional meeting or a collaborative web meeting or a conference call, just being willing to do that. There's a question directly to me. Sorry, they were not, the trainings were never in person, but they were like live and offered at a specific time. I apologize. So this is, they're still always going to be like on Zoom, but just the trainer won't be there live and giving it and answering questions. It'll just be the on-demand one. So sorry for any confusion. I said by in person. And then distributing the patient-reported outcome survey flyers and encouraging participation. Here's where we've changed something a little bit, just based on the feedback that we've gotten from you as the POs and around like the individual physician level requirements. So instead of having 3 case summaries per physician for this second cohort, we're instead adapted this to be hopefully a little bit easier for your practices to achieve without having every physician do 3. And so it'll be 1 case summary per practice on each of the 3 initiatives. So it would be 3 total per practice. And this time we didn't require that each of the 3 the physicians submit be from the 3 different initiatives, the CGM, the meds, and low carb diet. They could submit all on one if need be, or whatever makes sense. But for this next one, we'll do per practice, but each of the initiatives represented. Next, again, this is on this year's of just working with your physician organization to maintain a log of QI interventions so that you're more easily to give feedback on the PO level QI log. Learning community is the same as we had for year 1. So the physician level requirements and then the PO and practice level one. So that'll be the exact same. And then the last new thing we've added for this next cohort is to learn about coverage from your primary payer. So Dr. Richardson thought it would be a good idea for us to develop like really specific education, kind of going beyond what we have in the coverage guide that we've shared with you all around medications and CGM, to just cover it more broadly and create like some videos and materials for each of the main payers in Michigan. Then what your practice would do is choose based on their caseload mix of which payer makes the most sense for them to watch the like specific education on. And then there will be like a short practically applied post test, like you have a patient and you want to prescribe them a GLP-1, which one is going to be covered and things like that, so that they have more ability to work within their primary care payers. So there's a couple questions about, are we just changing this for cohort 2? Yes, we're just changing this for cohort 2. So we go through an approval process with Blue Cross Blue Shield on our VBR requirements each time. And so since those ones are set, we're leaving it the same for the current cohort, and we're changing this for the incoming cohort. Next, so we don't have this ready yet, but at our July sessions, we'll be going with you on the year 2 VBR for all your currently participating practices. So what we will be doing with that at the suggestion of Blue Cross Blue Shield is to kind of split this. So we would have the participation measures starting on 9/1/2022. So you'll note that this is shifting up 1 month from how it started this past year to be aligned with the normal PCP VBR start. Since we were waiting for Blue Cross to develop the incentive last year, it pushed it a little bit off cycle, but bring it right back on that normal PCP VBR start cycle. And then we would add a performance measure beginning in March 1st, 2023. So we're going to have similar measures. It really won't be drastically different from what was expected in year 1. We're not going to have them do case summaries again whatsoever in year 2 for the already existing cohort. That was, this first year. We're going to do different things in the second year, but participation in the learning community, again, attendance at regional meetings. So it'll be similar to this year's plus the performance measure starting. So, like it mentions down below, we have this split in starting, not all starting on 9/1, just because we need that additional time to calculate baseline rates and work with you all and the steering committee to kind of decide what that initial performance measure may be and get everyone's buy-in on that. So we'll likely be starting that on 3/1 and have like another 6 months of participation measures prior to that. So I wanted to thank everyone for their practices and you for attending the regional meetings. So we've had 6 of the 7. That's why only 6 are represented here. We have our 7th one up in Traverse City this week. These are the ratings that we received in the surveys that we did after each meeting. So all in like the 4.32 to 4.75 range across the different regions. So it's really great from our perspective to go out and get to meet with people in person and get to put some names to faces and create that interaction amongst the practices. And they've been really well received by the practices. So I've condensed here on the next few slides, just feedback we've been getting, what we've learned, what we're kind of thinking for the future ones based off of this. So one of the questions we asked is what they liked about the meeting. These first 3 things were the most frequently mentioned. So the nephrology presentation that Dr. Hung delivered on preventing chronic kidney disease was very well received amongst the practices. The overwhelming majority of comments were about being able to collaborate with other practices, the discussions that were had at the tables, like getting to learn what other people are doing and how it differs from how they operate at their practice. There's a lot of appreciation for that. People like the resources, the balance between the presentations and the discussions, that they were informative, and having the specialists there to specifically discuss clinical topics was another thing that got mentioned quite a few times. And then also the suggestions for future meetings. So I split this up into general suggestions that aren't specific to a topic. We already also asked about what types of things people would like covered in the future. So inviting the patients on the patient advisory board was something that was mentioned multiple times across them. And that is something that we're doing for the October one. So we let our patient advisors know about this at our April patient advisory board meeting, just to give them like plenty of heads up on it. We have another patient advisory board meeting in June, and we'll just keep revisiting the meetings at those and letting them know about them. And as we get closer, try to identify specific attendance at them. And as always, we definitely are happy to have more patient advisors on the board. So if there's people that your practices have met that would be a good fit for it, or that definitely let us know. Another main request was for virtual meetings. I want to note Blue Cross is requesting that these meetings take place in person. So I understand the virtual meetings are definitely easier to attend, especially after a long day of like just regular work. Fully get that. That said, I also just want to note that the main thing that people liked from it was the discussion and getting to talk to each other. And I really don't think that's very replicable on a virtual meeting, at least to the extent that we saw it at these. And also, we aren't really allowed to have them not in person. So we will continue to have these in person for next year as well. But do recognize that that is a challenge. And we tried to do our best to pick the best time frame for that so that we're not having it during clinical hours. But of course, it's always going to be challenging to find something that works well for everyone. Other general suggestions are more time with Q&A with the presenters, which we'll be doing, having team members or having collaborative members email questions before the meeting. So maybe we'll set up something like in a couple of weeks before these next ones where people can submit things ahead of time. There is a suggestion to have attendees vote on topics, which I think is really interesting and great. Sending the topics, having people bring their favorite patient education tools. That was a good idea. So those are some of the general ones. Topics that people want to cover in the future. There was a lot of requests for a cardiology presentation, so it's definitely something that we'll try to accommodate in a future one. A lot of requests for coverage around CGM, so with interpretation, integration of CGMs, requests on just covering some program basics and requirements, so we can build that into the fall one for sure. And then other requests on low carb diet content, behavior change, doing case presentations, weight management, hypertension, prior authorization. So a lot of great ideas from the collaborative members. We'll absolutely build all of these in at some point and try to prioritize based on what people said that they needed. So now switching again to another meeting, we have the June 24th collaborative wide meeting coming up. We sent invitations to register at the PO level a week ago on Monday to everyone. And unlike the regional meetings, as many people as you want to have attend from your PO, you're more than able to do that. So just have them register. Feel free to share the link. We got this approved for 4.25 credits for physicians, nurses, pharmacists, and dietitians. I also wanted to note, it's challenging because of course we would love to have the practices there, but we did not require collaborative web meeting attendance just because it's a full day from 10 to 3 and didn't want to take away from their clinical time doing that. However, your practices are welcome to attend the meeting. So if you want to present the agenda to them or see if there's anything that interests them and if they're able to attend, it's at the Inn at St. John's in Plymouth. They're more than welcome to. If they did attend a portion of the meeting, we can have it count towards their learning community requirements. So feel free to share the link to register with your practices, but again, it's not required. And we are going to be recording the portions of the meeting that would be the most useful to them, which would be like the accelerated sites giving their presentations on how they've integrated this work into their practices, and the keynote presentation by Dr. Ludwig. We'll make sure that we have recorded options of those two, so that understanding the difficulty of attending this in person, we still give them an option to see that information. So this is just the agenda that was sent both on the link and is on the registration page as well. So Dr. Richardson will open with welcome and updates. We have the accelerated site presentations where each will be giving about a 20-minute overview presentation on what they did to implement this work. We'll have a 40-minute like lunch and networking break where you're able to talk amongst each other, come up with questions for the accelerated sites, because we'll have a panel discussion right after lunch where we'll bring back that same group and you can ask them any questions they have about how they did things or what advice they'd have, etc. So we'll have time for questions there. We'll have Dr. Ludwig, who's the author of Always Hungry, the book that we recommended in some of our training sessions and on our website. He's going to be giving the keynote address on low carb diets and type 2 diabetes. We'll also be taking a look at the dashboard updates. So if you all recall, the next update to the dashboards in June is going to have those summary statistics. That's going to be the biggest change that we're implementing there, where you're able to compare performance across your practices compared to the collaborative as a whole, compared to the region, et cetera. So we'll be able to look at that data in a lot of really interesting ways. So we'll talk both about what we've been able to find in our kind of initial dive into that type of data and just show you how these new features work, and then end kind of with the future directions and what's next. Now just going to go into some quick updates and reminders of different things that are going on just to make sure we're all on the same page. So as a reminder, the initial case summaries from each VBR earning physician are due on June 1st. So about a month left to submit those, a little under. You can view in your admin portal on the VBR metrics who hasn't submitted them. And we'll also email you or let you know later this month, checking in like 2 weeks before they're due on anyone who hasn't submitted. And we are going to be relying on you to do the follow-up with the individual physicians, because we can't directly contact any physicians who haven't submitted it. We really only have the contact info for your clinical champions. So we would ask you to follow up with the physicians who haven't, and we have the link there too, so that you could submit that or share that with them when doing this follow-up. And just one last reminder on the Medicaid drug coverage event. So this counts towards the learning community requirement. It's May 17th, 5:30 to 6:30. We have about 70 attendees signed up for that now. So anyone at the practice is welcome to attend this. So if you have like an MA at the practices who does a lot of the prior authorization work, it might be useful for them to attend, or whoever would like to for the practices is more than welcome to join these. And I wanted to let everyone know about the next learning community event that we're going to be hosting. So we're aiming to hopefully have at least one of these a month. We have Dr. Oshman's talk in May. For June, we'll have the collaborative wide meeting if they're able to attend any portion of this. And also we're hoping to host this prior authorization panel. So some of the questions that we'd received from the regional meetings and others have been around like prior authorization support and help. And we want to learn from each other and learn from practices who are doing it well and who do have a pretty good process and approach to this. So we wanted to open up for panelists that you can submit to us from now until May 30th to identify. We're hoping to find processes that have been successful, examples of how specific offices handle their prior authorization process, EMR note templates, both office facing and patient facing, any software that practices may be using to make it easier, or ways to use the formulary to avoid prior authorization when possible, like suggesting substitutions, that type of thing. So if anyone from any of your practices participates as a panelist, so like from that last example, if you have an MA who does a lot of prior authorization work and they're willing to be a panelist on this, that will meet the PO level learning community event, and then attending this would meet the physician level one. So as a reminder for the PO level learning community, you could either do like a blog or interview with the coordinating center team, or have someone from your, not really your PO, but anyone that is represented by your PO at any of the practices share their expertise as a live event as a panelist. So this is what that second one will be meeting. So if you have an MA from one of your practices, do this, your PO requirement is met for every single VBR earning physician in your PO. So just as a reminder of how those work. So again, we'll send out an email too that just has a little bit more details and lets you know how you can sign someone up from your PO to do this. But we were looking for maybe like 4 to 5 panelists or people who have a good approach on this that we can learn from. We'll have some questions to start this off with, but then would hope that the attendees who are joining this also come prepared with questions and the things that they want to have covered as well. So it would be kind of a question and answer type session. And yeah, so we will send out an email with more details about that, and we'll hopefully set this up for sometime in June for your practices to attend. So we distributed our first learning community newsletter to all the clinical champions on May 2nd. So we really wanted this introductory edition to just kind of recap a lot of the things that we learned at the regional meetings, and also be a good introductory newsletter for any practitioners in the practice who are less familiar with MCT2D, to kind of have like a nice high level intro that's hopefully helpful for them. We're going to now begin putting these out monthly, and we'll continue to send them to both the clinical champions and anyone who subscribes. So we'll make sure to get those out to that whole distribution list. In the next one, we're going to be covering our first blog. So that's going to be diving into the details of the medication coverage with Heidi Dietz and one of her patients. So have both kind of perspectives represented there. We're going to have an overview of the regional meetings for like the practices, including like networking opportunities, express the ability to express interest in a partnership program around free food delivery to patients that we'll have a lot more information for you about soon. And we'll be sharing some new tools in that. So this next one is going to have a lot of new content, and this will kind of be the cadence that we put them out with each month, hopefully with a blog, with new tools, with new things that we're able to share with your practices. And just a reminder, the POQI logs are due May 16th. So that's a couple of Mondays from now. We have the link here to submit. We'll send out these slides and you can see it on your admin portal, and the link is contained there as well. And then just wanted to remind everyone about the next couple of things with the Data Hub release schedule. So MDC was able to put out this May data refresh a little bit early. So that went out, I think, on April 28th, and you should have received an email about that. And then the next one is the one that we'll cover at the collaborative wide meeting. So MDC is shooting for June 13th to both update the data through the end of February and to add in those new features with the summary statistics, among other things. So should be soon, and then you'll get the next update again in October or August, sorry. The next is the pharmacist and dietitian sessions that we mentioned at the collaborative wide meetings. Actually, it was from the feedback from one of the attendees suggesting that we do these for the pharmacist as well as the dietitian, that we added that option too. So we've gotten about 90 responses on those. Everyone chose 12-1 overwhelmingly as the time that would be the most convenient to have these drop-in sessions. So we're going to schedule these initial sessions in June. We should I'm hoping by the end of the week have the dates, end of the week or next week have the dates for these first ones. We asked for the email address of anyone who wanted to attend and who filled out the poll. So we'll send it to all 88 respondees. And then of course you'll be able to forward it. The only challenge of forwarding things is if they're canceled or changed, the person it's forwarded to won't get that. So ideally people would fill out this poll and we'd have their direct contact information to make sure that they get these meetings when they're scheduled. So we'll have those. And we are thinking of having these count for the learning community requirement to participate in these as well, or to join these and ask questions. And I want to hand it over then to Dr. Ashman, if you're on the call, to kind of cover a couple things that we wanted to clarify with the POs, just some things that we heard like weren't completely clear on a couple of our clinical recommendations. So I'm going to hand it off to you, Dr. Ashman.
Thanks. Can you hear me, Jackie?
Yes, I can.
So we're really grateful for all of the feedback we received, both for our regional meetings and then, coming back to us and to Blue Cross about the trainings in general. One of the things we've been very careful about deliberately communicating to both you at the PO level and to the practice champions is the role of keto and very low carb diets in combination with the medication class SGLT2s. So for those of you who are more clinical, SGLT2s are medications that essentially eliminate glucose from your bloodstream by moving it into your urine. You pee it out. In this case, when combined with a keto diet, a diet very low in carbohydrates, someone who was also sick or had the flu or wasn't eating could develop something called diabetic ketoacidosis, which is a medical emergency. So in the medications training, the low carb training, the tying it together training, and in the materials, we've really gone through them carefully to note that patients who are using an SGLT2 should not be prescribed a keto or low carb diet. And then, for physicians, clinical folks, making sure we ask people, what are you eating and how are you eating? Because this is in the popular media, unless we ask, patients may not tell us. So we're just informing you to make sure that if physicians, clinicians, or practice champions are clinical champions mentioning this to you, just you're welcome to send them back to us, and we can reiterate again that is a clear recommendations we're making. The second clarification that has come up a few times is, is our quality improvement goal to make sure that every patient is using a GLP or SGLT. Every patient is on a CGM, every patient is on a keto or low carb diet. And the goal for our collaborative is to initiate, teach, inform, educate, implement these interventions and practices so that we remove all of the barriers so that this is easy for people to apply to the right patient. So when we think of personalized care, precision care for people with type 2 diabetes, it means that as clinicians, we are selecting which of these interventions might work for which individual patient and which might work together. So that goes back to SGLT2 inhibitor medications and keto diet not working well together. That also goes at the PO level, that we have no anticipated goal to set a certain percent of patients who are receiving these interventions. We frankly don't have the data to identify that at this point. And our goal is really diabetes control. And we're thinking that combining all of these tactics along with other things that we may think of implementing in the next few years will get us there. So if your members are talking to you about, worrying that they're not meeting their numbers or initiating enough patients on these medications, that is not one of the goals of the collaborative. So if that brings up any questions, please place them in the chat. If you've kind of gotten that feedback from your members, please let us know. We're happy to provide this information in other ways as well. Jackie, you're still
so much, Dr. Ashman. Yeah, sorry, I was trying to get unmuted. All right, great. Thank you for covering that. And that was all that we had today to cover with everyone. So we're not going to host these again in June because we're having the collaborative vibe meeting then. And so we've been determining to cancel these most of the months that we have a lot of other touch points with you. And so these will be occurring again in July. So either Monday, July 11th at 11 or Wednesday, the 27th at 2 p.m. And we'll have next year's VBR finalized for your 2 practices. And we'll go over that with you, among other things with that. So any final questions before we wrap up today? Okay, thanks so much everyone for your time. We'll send out the slides for this soon, as well as the prior authorization panelist email too, so you can begin recruiting people for that. Thanks so much, everybody.